Hello guys, quick summary about oral white lesions, okay? So those are the white lesions that you guys will see the most in your careers. So this is a very easy classification and there is a recommended reference and I'm going to show to you guys very soon. So congenital lesions, we have several of them, but we can say that leukoedema is basically the most common one. And how you detect the leukoedema? Well, it's usually on the cheeks, on the surface of the mucosa of the cheeks. And then if you stretch the tissue, these folds, the oral folds, the white areas of the leukoedema will basically disappear, okay, or decrease mostly. Of course, that's congenital and not scrapable, so you cannot actually remove the lesion by scraping off. Then we have acquired and scrapable, and the main one, of course, you guys know, it's candidiasis, right? So candidiasis would be the white areas with the you can have red areas surrounding because this would be inflammation, and those are scrapable, okay? So very common of candidiasis. The plaques that are removable, they are scrapable, okay? So you can scrape them off. Then you have acquired and not scrapable, and those are Lichen Planus, the main ones, Lichen Planus, and then you have two main patterns. The reticular one, so you have those polygons being formed by the white areas, and then you have the plaque style of the Lichen Planus, so the plaque presentation. I'm going to show you some images and the reference, of course. So we have Leukoplakia, and then Leukoplakia, the surface is more irregular, so it's different from Lichen Planus. You guys will see on the image very soon. It's not scrapable and it's pre-malignant, okay? So you should realize that. When we start to see ulcers and then elevated borders and characteristics of malignancy, then you suspect of SCC, so squamous cell carcinoma, like the one that you guys are seeing here. And then even more common than those, we have hyperkeratosis, which is basically an increment of the keratosis layer of the epithelial tissue. So now the tissue is a little bit more white. We have these white areas in the tissue, and basically that's usually frictional or very close to areas where the patient is biting. So for example, areas of the on the cheek inside that the patient is biting, and then those are hyperkeratosis. Okay, so very common as well. All right, on the alveolar ridge, on the top of the alveolar ridge, the dentulous areas, the dentulous spans, especially if you have prosthesis, okay, adapted to those areas, then as a reaction we can have hyperkeratosis. Okay, pretty much straightforward. So let's see those images a little bit better. Let's see now, let's understand those differences, okay? So we have Leukoplakia, pre-malignant, Lichen Planus. The two main patterns, of course, we have other patterns as well. I'm talking about the main ones. So remember that this is just a summary to support you guys during your clinical careers. But check the recommended reference, which is one of the best articles that I found for summary of white lesions, okay? Then candidiasis, leukoedema, and hyperkeratosis, of course, that's very common, okay? Characteristics of malignancy, elevated borders, don't forget about that. Ulcerations, not symmetric. Very common, sites common intraoral would be the tongue, lateral borders of the tongue, the back of the tongue, of course. And, well, it can happen basically in other areas of the oral mucosa as well, right? But you would realize that this is an aggressive lesion as well, okay? And then we have the actinic cheilitis that's on the lip caused by the sun. So an example of photocarcinogenesis. So we are talking about the pre-malignant lesion on the lip that can develop to squamous cell carcinoma of the lip. And this is related to the sun, to UV light, okay? We may have the angular cheilitis, of course, on the corner of the mouth. That's also common. Those basically are the main or the most common, let's say, white lesions. Of course, a papilloma, for example, can have sort of a ischemic aspect, but it's not actually a white lesion, okay? I heard this question before, that's why I'm saying this now. So that's basically how you differentiate them. So read the reference again and use this to help your studies. See you guys in the next videos.